Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I have Jake Glanville on the line, and he is CEO over at Centivax Inc. Jake, welcome to the show.
Adam, thanks for having me on.
All right, so excited to get into Centivax and what you're up to there, and also talk about really what would make the national vaccine conversation easier and get a little bit more into your background as well and success at Centivax. But just to get us kicked off here, we like to start this episode with what we call our Mission Matters Minute. So at Mission Matters, our aim and our goal is to amplify stories for entrepreneurs, for executives, for experts, for people that we feel need to be heard and want to amplify their stories. So that's what we do. Jake, what mission matters to you?
So at Centivax, we're the universal immunity company. We have a universal vaccine technology platform, and we're using it to create vaccines that actually work against flu and coronavirus, that will work against all the strains. That helps a Pavlovian problem of people being like, I took a shot and I still got sick. And it solves a bigger issue where if enough people take these kinds of vaccines, then flu starts going away and coronavirus goes away. That's a gift to future generations. And so that's a technology we're super excited about. There's also applications that got all over the media recently with our universal antivenom program, which again is a single shot you could use for any snake. And so these are the kinds of 21st century medicines that we think can make really a huge difference in human health going forward.
Yeah. Great. Love bringing mission-based people on the line to share how they do what they do, why they're doing it, and really what we can all learn from that so that we all grow together. So great having you on. I'm curious, how'd you get into this business? Like, where'd that start for you?
Yeah, so I'm an American, but I grew up in a Zutuil Mayan village in the Mayan highlands of Guatemala. My parents were innkeepers. And, yeah, they had the Posada de Santiago. It's a small bed and breakfast in this Zutuil village.
That just sounds so cool.
It was different. It was definitely I miss it. And so, yeah, I grew up in the village, and it was rowdy when I was a kid. There was a civil war going on. There was shooting at night. This crazy thing happened that kind of changed my life, where I'd gone up to go to college, and the civil war ended, and then NAFTA changed things as well. And I came back to the village, and I remember walking across the central courtyard, and I saw these kids playing basketball, and my brother and I looked over, and we're like, who the hell are these kids? And then we were like, wait, those are Zutuiles. And young teenagers. And the reason we were surprised is that ever since I was about 11 years old, I could go out to the open market where they sell vegetables and fruit and stuff, and I could look across the entire market and see my parents because I was already taller than everybody in the village. And I just, at the time, I just took it for granted, right? I was like, I'm embarrassed by this now. I just was like, oh, it's genetics or something, I'm not very tall. Well, these kids were my height playing basketball, these young teenagers. And after I saw that, I started looking around and I noticed all the young teenagers are like a foot taller than everybody else in the village.
Interesting.
And so what happened was, I go ask what's going on here. It's when the war was over and they had better access to medicine from NAFTA and so forth, they started distributing antivirals or anti-helminth, deworming medicines, and they had a better access to vaccines in the schools. And it was this simple medicines were changing people's lives. It wasn't they were just taller. They were doing way better in school because they weren't sick all the time, and it's hard to concentrate, and neurological development's interfered with.
Yeah.
And I was like, it was crazy to watch it. And this is something that's happened, by the way, globally. It's just most of us, it's happened too slowly for us to see it. If you go to old castles in Europe, you'll see these tiny little beds and little rooms, and you're like, wow, people used to be short. What happened? It's that we used to be heavily infested. And it made me think two things. One, I was just embarrassed that I was, in my ignorance, just assumed it was like genetics when it was actually this hidden vampire sucking away their potential. But the second thing is I was like, I wonder what I'm taking for granted right now that in the future I'm going to look back and be like, that was horrible. We should never have put up with that. And I looked around and I realized the world is still infested. We have a global pandemic 2 times a year, which we call the flu. And we're now putting up with coronavirus. We have these outbreaks of all these different pathogens. There are billions of infections a year, and we have 15 million people die a year, and there's all this long-term morbidity with Alzheimer's and heart attacks and cancers increasingly associated with infection, and we just put it up with it as normal because we don't know any better. And so I began to imagine, I realized I never really left the village, right? And I was like, what would the world be like if we could fix that, if we could get rid of this constant pathogen burden that gets in the way of the human condition? And so that's what got me interested in this space.
Mm. And so how did this, as you kind of were transitioning it, how did you know this was going to be like an entrepreneurial endeavor to where you'd start a business and you start, because I'm curious, because a lot of people want to do good, they have a mission, they have other things, but to make it something that you're going to spend a significant amount of time on and you're not just maybe going to volunteer or this or that, like how do you know that piece? That's interesting to me.
There's two parts to it. One is the idea of making it a business, and the second is not being scared to jump in. So business was never scary to me because my parents, it's a small hotel and a restaurant in the Civil War, but honestly, it's actually not that different from running a biotech in the private sector.
But the way you say it, come on.
Well, you got
small hotel bed in the middle of the Civil War. It's fine. Like, go ahead.
It's the same stuff, man. You got inventory, you got recipes, the protocols, you got personnel, you got to deploy them. You have to maintain quality product and quality assurance, and you got to get people in the door, and you got to shuffle things around when a scorpion shows up in somebody's room, right? It's being able to be flexible but focused and be able to balance. Like focus doesn't mean what a lot of people think it means. Mm-hmm. It doesn't mean focus at one thing. It means knowing how to balance what matters. Mm. I had a lot of people. Everybody runs a small business down in Guatemala. So there's little details that are different, but I was always comfortable with that. And then for what happened was originally I was at Pfizer doing antibody discovery, and I developed some technologies that use these next generation sequencing instruments to look deeply in the immune system. And I was looking in trying to figure out, like, why does the immune system miss? Like, why does the immune system not hit the Achilles heels on these pathogens that would result in a universal vaccine or universal antibodies? And I started getting these new ideas for doing it, and a technology concept emerged. And so I founded a company because this is not a science project, it's a business. Like the way you change the world, and the world change could be profound, right? A success here could end the job that Edward Jenner started 230 years ago and could eradicate some of our most ancient enemies and create a future for every generation of mankind that's better, where people 1,000 years from us are high-fiving us to the past, thanking them for leaving them with a better world. But to do that, you can't just do that in a lab. That has to surf across a tsunami of profitability. That's how you change the world, is you make it economically irresistible to go have way better health, way less problems with our, not just the infection, but it's all the stuff that comes after. Less of $900 billion a year we spend on Alzheimer's and neurodegeneration. Mm-hmm. Less of cardiovascular events. That's a huge space, and that was how I was going to change the world, was by harnessing that value, and the way you do that is in business.
Let's get into a little bit about the vaccine conversation and what that looks like. How do you make that more, I don't even want to use it easier, but how can we handle that better, like in the United States or globally?
Yeah, so, I mean, clearly we had a pandemic recently, and during that pandemic there was a mandate, and a lot of people were pissed off at getting a mandate, right? And look, to be blunt, I think I was on the wrong side of this, because at the time I was just like, let's just get this goddamn, excuse my French, let's get this pandemic over with. But in retrospect, it was un-American to be able to insist on a mandate. Unless there's a zombie apocalypse, it should be voluntary. And as a consequence, there was blowback against, all that fear and frustration kind of harnessed towards the vaccines. Mm-hmm. So my goal, I don't think everybody has to get vaccinated. I don't believe in mandates. I think that you should. I vaccinate my own family and my kids, but I think it should be the benefits of the technologies and it's the carrot, not the stick. And so the easiest thing that we could do to make the conversation easier is make more effective vaccines. The whole problem with flu shots and coronavirus shots is that people take them and they still get sick. And it's really hard to communicate someone and be like, well, your probability of getting sick is reduced by 35%. Like, that's just not intuitive. People want to take a vaccine and not get sick. Nobody complains about getting a rabies shot, right? Because they don't get rabies. And so I think that we're working on these universal vaccines that provide reliable universal coverage that doesn't matter if the virus is shifting and changing. And I think that just makes the conversation way easier, because people are like, yeah, I took it and I didn't have to worry about flu for the next 5 years. Like, that's a breakthrough, and it'll make the conversation easier.
What does success look like for Centivax?
Well, you don't get into entrepreneurship by thinking small. So there's a ladder of success, and obviously I'm economically rational and flexible. The thing about what we're building is that it has the ability to just completely change our relationship with a number of these diseases. In the short term, it's things like a flu shot that actually works. We've been making flu shots for 80 years, and they still are mismatched every year. You take a shot, and they're like, 35% effective. Like, that's absurd. We should have it, you take the shot, and you don't worry about flu for the next 5 years. So there's a series of markets that have this problem, right? That's the coronavirus vaccine problem. That's why we don't have an HIV vaccine. And so the technology has a large number of application areas. And similar with our antivenom program, you'd like to have just one antivenom that works on all snakes. That would be an amazing breakthrough. You could unify a fractured market. The long game is that once you have tools like that out there, then 15 years down the road, your patent cliff is approaching. And you might as well attempt to do an eradication campaign, get rid of some of these pathogens, purge them from the earth forever so that your children and children's children never have to worry about them. And so that's part of the game, is to create those eradication tools. And then the final part is, like, we have a follow-on program for a vaccine that works against a whole bunch of viruses that infect your brain. And you have them. You have 5 of these viruses in your brain right now, so do I. They reactivate over and over throughout our lives. They're associated with increased chance of Alzheimer's and neurodegeneration. There was recently work that came out this year showing that people who got shingles vaccines, which treat one of those viruses, results in like a 20 to 30% reduction in Alzheimer's. And people who take valacyclovir, which treats 2 other of those viruses, those people have a 50% reduction in Alzheimer's. And so we're working on a universal vaccine to treat all of those viruses. The idea being it will be basically an Alzheimer's vaccine to reduce the $900 billion a year that we waste on trying to treat and trying to care for a huge number of people in this country that are slowly losing the sense of self as their mind is being attacked. And so I think creating a world where we can die with dignity in old age and live healthy while we're alive and don't have to worry about the constant weight of these infections is that dream I brought from my childhood in the village to now. And it's kind of what I see. We're in the biotechnology golden age. It's our opportunity with our generation to make those changes. And so that's what I look forward to with this company.
Amazing. Jake, this has been a lot of fun having you on today. I know I learned a lot. I'm sure my audience did as well. That being said, if somebody wants to follow up, learn more, connect, and really follow the Centivax journey, how do they do that?
Well, they certainly can go to our website at www.centivax.com. I also maintain a pretty active conversation with a large number of folks on LinkedIn, and so they're happy to reach out to me and some of I kind of gathered the Jedi at the company. We've got a bunch of great people here. We maintain those conversations, and we like to interact with the community, so I'd invite you to connect there as well.
Yeah, that's wonderful. And for everybody listening, just so you know, we'll definitely put some links in the show notes so you can just click on the links and head right on over. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. Each and every day we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way in your journey as well. So again, hit that subscribe or follow button. You heard me right. It's daily. We got many more interviews coming up. We don't want you to miss a thing. And Jake, really appreciate you coming on. Thanks for making some time for us.
Adam, thanks for having me on. This was great.